Ever since I've been a physician, and especially a physician who specializes in respiratory conditions, climate change is a huge deal for us. It's very clear that in the state of Tennessee, our winters are getting warmer. And with that comes not only more pollen, we have studies looking at pollen levels. We see an increase in the quantity and the potency of this pollen. And that's going to have a significant effect on respiratory conditions, especially asthma, where the majority of asthmatics are allergic asthmatics.
I like to go fly fishing a lot, so seeing all the toxins getting in the water, that kind of woke me up, and I was saying, like, we need to do more to combat climate issues. That was one of the things that motivated me to do the research and find ways to combat climate change, because it affects asthma in so many ways.
If you've ever been around someone having an asthma attack, they breathe so loud, it is so loud, it will wake you up in the middle of the night. Of course, I'm a mom, so I wake up anyway when they breathe funny, but the whole house can hear it because it is such a struggle to take a breath. And so when you have that example and you've seen that and you've heard that and you've had to throw a child into the passenger seat and race to the hospital because, you know, the inhaler's not cutting it and you got to get them on oxygen, then you are motivated to do everything that you can do to stop that from happening. So, you know, we pull up carpet and we vacuum every day and we just do everything we can to make his environment as clean air as possible.
From a personal standpoint, most of my experience comes seeing patients with life-threatening asthma. When you have a family member or a patient who clearly is doing well indoors with air-conditioned air and then goes outdoors and the warnings have been made available and those patients get worse immediately going outdoors, we know that's making a major contribution. So we can rest assured that those are direct findings, direct evidence that the pollution is aggravating specific people.
If I had to describe what a sustainable city would look like, it's one where we've got a thriving economy, where our jobs are industries that aren't on their way out, but they're industries that are growing. They're industries that are creating the jobs of the future to make either our local community or the world a more sustainable place, a greener place. That our economy isn't based only on just extraction of natural resources, but how do we regenerate those resources over time and not just take, but also give back. It's a place where families can go outside without suffering asthma impacts. Can go explore natural areas that are in their city without having to drive 3 hours to get to a national park, but have those types of natural experiences in their backyard and in their community. And it's a place where, you know, at the end of the day, I think we have a diversity of residents where folks are interacting with their neighbors who maybe don't look like them or come from the same background, but that we all respect each other and say, you know what, we're on this earth together. We've only got one earth.
I don't have asthma, but I'm the voice for my child and the voice for a lot of other people who may not have this opportunity to be involved in something like this, and to speak out and say, our children are suffering. We live in a city where our children are suffering just by the air they breathe.
I just spent about 2 years working on my undergraduate thesis on air and asthma in East Tennessee. Right now this is causing problems, but with this new legislation coming out, it addresses the fact that climate change is already having effects on this country. It affects people's health, affects their environment, the energy grid, and so what this will do is kind of bring it into the public sphere and convince people there's a need to address climate change now.